Hi everyone, my name is Celine Ho. I'm the director for the Valley Homeless Healthcare Program. We are going to take our mask off now to allow the ASL interpreter to better understand and follow our conversation. Before we begin, I wanted to let everybody know of the current COVID cases that we have. As of July 14, 2020, yesterday, we have 6,725 cumulative cases, 170 cumulative deaths, and of those, we had 3 new deaths. Our condolences go out to the families that are affected by this pandemic. The COVID-19 pandemic has affected everyone in the county and even around the world. During this time, one group that we're especially concerned about are people experiencing homelessness. Santa Clara Valley Medical Center's Valley Homeless Healthcare Program has been bringing medical care, behavioral health services, and support services to homeless individuals where they are. VHHCP, as it's also known, has been really has been playing a critical role in ensuring that our folks are safe and healthy during this pandemic. Joining me to talk more about the Valley Homeless Healthcare Program and to give us an overview is Dr. Galotra, our medical director for the Valley Homeless Healthcare Program, and Derek Everett, our community outreach specialist. Welcome to you both, and thank you for taking the time to be here with us today.
Thank you.
First off, I'm going to start with Dr. Galotra. Can you tell us a little bit more about the Valley Homeless Healthcare Program and some of the services?
Absolutely, thank you. So the Valley Homeless Healthcare Program is a federally qualified health center that's part of Santa Clara County Health and Hospital System. The homeless program has the core belief that every person deserves dignity and the highest level of healthcare possible. We believe that that every person should have the highest standard of healthcare, the same standard that you or I or all of us would receive at an academic center or a private institution. Further, we believe that healthcare is a human right and that homelessness is a problem that we can solve. And we are working to solve it every single day on the individual level and on the community level. On the ground, the Valley Homeless Healthcare Program is a collection of 15 access points. We have our standard brick and mortar sites, which are just similar to the doctor's offices that you and I would go to. We have 3 mobile units, which are large RVs with exam rooms, pretty much like a doctor's office, equipped like a doctor's office, that go to different places around the county where homeless people congregate. So these are shelters or general assistance office or the reentry center, where we know a lot of people coming out of jail or prison end up homeless. Different high schools around the county where there's a high proportion of people who are teens that are homeless or families that are homeless. We have our street medicine team that goes out to different encampments, as well as our respite, which is a place for people to recover when they're coming out of the hospital, so they can recover with dignity instead of recovering on the street and ending up back in the hospital. Our mobile units and our clinics span pretty much the entire county from Mountain View all the way down to Gilroy. And at all of these sites, we provide multidisciplinary care. So we'll have medical doctors, mental health providers, psychiatrists, psychologists, social workers, nurses, outreach workers, pretty much every discipline that we can think of so that we can wrap around people, take care of them, improve their quality of life, and hopefully end their homelessness.
Thank you so much. Dr. Galotra, you have mentioned the street medicine program, which is also our backpack medicine program. And this program is such a key to what we do because we're able to meet our folks out in the where they are. Can you talk a little bit more about that program and the team?
Sure. So our street medicine program has been around for many years. And its goal is to really go to where people are and provide the medical care that they need where they are. So it's made up of a medical doctor, a nurse, an outreach worker, and sometimes a mental health specialist. And we call it our street medicine program or a backpack program because that's really what it is. We load up medications and wound supplies and anything that we need in backpacks, and we hike to different encampments all across the county. Some, we'll see people sleeping on the side of the road. We'll see people staying deep in the woods or way down a trail. And the goal of the program is to take care of people's acute needs. So if they have a wound, or they are feeling sick, or kind of whatever those acute needs are. And then over time, we've learned that a lot of people who are in encampments have a lot of trouble seeking regular medical care. So we've started to bring primary care to the streets as well. So we'll manage their diabetes, we'll manage their high blood pressure, their heart failure, take care of their cancer screening, all of those things that you would go to our doctor's office or mobile unit for, we'll take that into the field. And then more recently, we have been doing a lot more work around COVID. So we've been going out to these encampments and all these places to teach people about the virus. And that was especially important in the early parts of the pandemic, but also to test people or provide treatment or therapy, whatever is needed.
Great. And Derek, you are part of the backpack medicine team that goes out to the encampments and some of the other shelter sites. Can you tell us a little bit about your role as the community health outreach specialist and what you do as part of the team?
Yes, so my role as a community outreach specialist, especially with the backpack team, I provide transportation for the team. I scout some of the sites before we go to the sites. And then once we get there, I help provide more of the social needs for some of the patients that we do see. As an outreach specialist, I also do case management. So while the patient might be visiting with the doctor while we're out in the encampment, I'm talking to other patients that are getting ready to speak to the doctor or may have some medical needs. But as they're waiting, I'm also, talking to them, explaining our program and explaining what I do as a community outreach specialist, especially on the social part. So which can be if a patient basically needs to get to the DMV and lost their ID, we'll make plans for me to transport them and make those needs possible. And then overall also providing assessing the area, making sure everybody's safe while the doctors are attending to the patient, and just being there to help out with the patients and letting them know more what I do, and then make sure that if there's any follow-up, like for follow-up appointments, what a lot of them will have, I will make sure that they could get to their follow-up appointments, or also dropping off meds. If they get prescribed meds that day, they might not be able to pick them up, so I will provide and pick up the medication and bring them back and help, bridge that gap for the follow-up appointments and the care that they might need that day.
Great, and all the work that you've done is such a key to make sure that our patients are healthy.
Yes.
So that's great. Dr. Galocha, you had mentioned also there's been some testing that's also done at the encampments. Can you talk a little bit about VHHP's efforts around testing?
Yeah, so we basically have been testing in two strategies. Early on in the pandemic, we had our backpack teams going out there, doing education. We actually ended up adding another backpack team to have two full-time teams, teaching people about the virus and then testing people if they were symptomatic. As testing capabilities have increased, we've deputized 3 teams that are made up of nurses to basically hit up every congregate, shelter, every large encampment, any place where homeless people are together, to test them whether they're symptomatic or not. So we offer this testing. We've been doing it for almost 2 months, and the program has so far operated very well. Some people have been tested multiple times, and we've reached pretty much all the places in the county where homeless people are congregating. We plan to continue this effort as long as it's required to help control the COVID pandemic.
Great. And Derek, part of the major work that you do is around providing education for COVID-19 and also to engage folks that want to get tested. How are you doing that to engage our population and ensuring that they are getting tested?
So like Dr. Galocha said, we have 3 teams that Valley Homeless and the county we have going out right now. Team A is pretty much focused on the shelters and the motels, and then we have a Team B and Team C, which is going out to all the encampments in Santa Clara County. My team is Team B, so I'm one of the teams that are going out into the encampments. I'm partnered up with 2 travel nurses and a community worker, and we're going out to the encampments. We announce who we are. We're very well known for doing backpack medicine for Valley Homeless, so we announce who we are. We're Valley Medical, and we let them know we're here to test for coronavirus. A lot of them know about the coronavirus, but there's a lot of patients out there that don't know, so we educate them about it. And then once we do that, we ask them if they like to be tested. If they decide not to be tested, we go ahead and let them know we'll be coming back to the site every month. And then as well, we just go ahead and give them the education of some of the symptoms of COVID, and let them know that also we're partnered up with OSH, Office of Supported Housing, that will help them out too if they do become if they are positive. OSH will help out with putting them in a motel and so they could quarantine for 14 days.
Yeah, and you had mentioned we've done a lot of testing over the last few months now. So as you're going out there, what happens when you do find someone who tests positive? I know Derek mentioned a little bit about that.
Yeah, I can add a little bit. So basically, when a positive test result comes back, or even if someone has symptoms and we're waiting on that result, we definitely want to make sure that they are in a safe place, and we want to decrease the risk of any spread. So we will safely transport that person to one of our quarantine sites to basically keep them safe and keep the community safe. And we will keep them there until their symptoms are gone, or if they test positive, until they are appropriately cleared by public health. And we've worked very closely in collaboration with the Office of Supportive Housing and the City of San Jose to be able to staff these sites and provide pretty much all of that person's needs, so there's no reason for them to have to leave that quarantine situation. So they'll get their food, laundry, kind of the services they need, really to protect the community.
Great. And Derek or Dr. Galocha, we've talked about serving our homeless individuals and stuff. Is there a story that that really stands out to you during this pandemic that resulted in an successful outcome that you want to share?
Yeah, there's a story about a couple of weeks ago. My team, Team B, were out in one of the encampments and doing our testing, and there was a gentleman, older gentleman, standing off to the side, probably mid-50s. He's asking a few questions, basically what we were doing out there. We explained that we're testing for the coronavirus. At that point in time, he decided not to get tested. So while the nurses were testing one of the other patients, I was talking to the gentleman, and he stated that he was newly homeless due to the coronavirus. He mentioned that his car had recently broke down, and that the line of work he was in had some background working with concerts and concert venues. And basically with Corona going on, there's no concerts going on, so he hasn't had no work, which ended up being one of the main reasons why he temporarily homeless at this point. So I went ahead and explained our program. He had never heard of our program. Explained our program, explained what we do, and in that conversation, he started to get more relaxed and was really surprised that our county and provides a lot of programs for homelessness and support. And so once in the conversation, once he was learning more about that, he started feeling more comfortable, and he did decide to go ahead and test for the coronavirus. And again, I gave him a few numbers to call, gave him the number for Office of Supported Housing. They do have a hotline, so people could call and try to get a shelter bed or something. And he's very pleased about that. And like I said, he ended up getting tested, so I think that was a good outcome.
Yeah, that's great. Our program has been around for quite some time, and there's still a lot of folks out there that don't know about us, and so it's great that we're able to engage them and bring them in. We certainly have still a lot to do to serve our homeless population here in Santa Clara County, but it's also gratifying to know that we're able to make a positive impact on some of the folks that we're serving. So
Definitely.
Thank you so much to you both for being here today. If you know of anyone who's homeless, please refer them to our program. They can go to scvmc.org and search for VHHP. Also, for the latest information on COVID news, please visit the county's website at www.sccgov.org/coronavirus. And please continue to shelter in place, wear your mask when you're outside, and wash your hands, and especially take care of one another. Thank you so much.
Thank you.
Thank you.